Good evening, everybody. This is Dr. Lynn Patrick. I'm here with Dr. Walter Crinian. We are going to give you a follow-up to our wildfire smoke challenges and solutions for human exposure by popular demand. So we are here courtesy of the Environmental Health Symposium. For those of you who have not had the chance to I'm going to let Dr. Crinian get settled here. For those of you that have not had the chance to take a look at our part one, it's available free both on the EHS Environmental Health Symposium 2019 homepage and the Naturopathic Academy of Environmental Medicine. Naturopathicenvironment.org is the URL for that organization that I belong to, Walter belongs to. You can view the webinar in its entirety for free on either of those websites. And I would strongly suggest that you do, and I'm going to give you a good reasons to at the beginning of this. So the Environmental Health Symposium coming up in Scottsdale, Arizona, April 12th to the 14th. Both Dr. Crinian and I put on that conference. This year's conference is on endocrine disruption. It is so much more than just hormones. We're going to be having some leaders in the research area and clinicians as well, talking about all the conditions that we all see in our practices that are related to endocrine disruption, the problem and the solution. So we'll be very clinically focused. You can find out more on our website. That's a live link, EHS 2019. You can right click on it and it is live. And oh, by the way, I think our producer is putting a link to the slides in the question and answer area. She can let us know. I'm not able to see that right at this moment. But you can download the slides, everything that we're presenting tonight. That's available to you in PDF form. And the Dropbox link should work right now. So again, endocrine disruption, it's something that all clinicians need to know about. Dr. Crinian and I feel so strongly about that we are going to have a whole conference on it. And we would really love to see you there. So part two, we're going to get real clinical and we're going to talk about what interventions we feel are both have a lot of research behind them and we found to be very efficacious. So in part one, if you haven't seen part one, Dr. Louise Tolzman does an excellent job of reviewing all the toxicants that we know are found in both wildfire smoke and building smoke, right? Because it's not just the trees that are burning, it's buildings and everything in them, and including vehicles. So she talked about all of these particular toxicants and how to test for them. And we're going to talk tonight a little bit about interventions that will cover this entire list of toxicants. What I'm going to talk about tonight are just a few of the things that I think there's compelling evidence for. B vitamins, vitamin C, vitamin E, and sulforaphane. So let's dive right in. So we talked a lot in part one about the kind of the how we get from exposure to air pollution and specifically PM 2.5 and below, how we get to that, and what we know is a significant risk of not only having cardiovascular disease, but dying from cardiovascular disease. And so I want to run through this really quickly so that you can understand why the interventions that I'm going to talk about work. So we know oxidative stress, one of the very well-researched and very damning effects of oxidative stress is that it damages the endothelial lining of all vascular surfaces. So all arteries, all veins, all venules, all arterioles. And that damage causes not only inflammation, but an increase in macrophages, white blood cells, and cytokine release vascularly. And that's the genesis of what we know is cardiovascular disease and cerebrovascular disease. The other thing that this oxidative stress does is that it causes a dysregulation in the autonomic nervous system, specifically the autonomic nervous system through the vagus nerve that controls the heart. So we're going to talk a little bit about heart rate variability and what helps heart rate variability. At last, but certainly not least, and Walter's going to wax on this, is the depletion of antioxidants that is caused by oxidative stress secondary to exposure to air pollution or wildfire smoke. This is a particular problem in those with genetic single nucleotide polymorphisms for glutathione S transferase M1. That's a gene deletion, actually. It's not really a SNP. I should have just put a GSTM1 gene deletion there because it's not a single nucleotide polymorphism. You don't have an operable gene there. So what this all looks like and how it works is it starts in the lung. And the actual battle between the oxidant effect of the PMs, the particulate matter, and the antioxidant system of the lung have systemic effects, not only on the vascular system, but on the heart itself. And so I talked about macrophage recruitment. I talked about cytokine release. It increases permeability of the alveoli, just like the gut barrier is breached, the alveolar barrier is breached too. And then, what I think is really probably the most important thing here, talking about disease and death, mortality, is this alteration of the autonomic nervous system. So we're getting an upregulation of the sympathetic nervous system, decrease in heart rate variability, increase in sympathetic tone that leads to constriction, and eventually that contributes to plaque rupture and an event. So what will help? This beautiful study I'm about to talk about, I think, is really pretty groundbreaking. What we know is that air pollution itself will elevate plasma homocysteine. Plasma homocysteine is by and large kind of a surrogate. It's a marker for something else. We know that methylation, methionine, the methionine cycle of SAMe to homocysteine and back to SAMe is interrupted somehow. We know that methylfolate, when we intervene with methylfolate, that can actually act as an antioxidant. It's no longer can we say B vitamins are just to run through the Krebs cycle. We know that B vitamins are very, very potent antioxidants. Not only does methylfolate lower homocysteine, but it also has a very strong role to play in improving nitric oxide availability. And this is probably, at least there's some very strong evidence that this is what prevents the inflammation in the endothelial cells that causes cardiovascular disease. Finally, we've really pinpointed it. So methylfolate is really critical here in improving the ability of nitric oxide to work as an antioxidant and as a vasodilator in the vascular system. So this beautiful study was a pilot study. I'm going to show you in a second. That was put together by Columbia, Harvard, the University of Toronto, and the University of Peking to really start to take a look at how B vitamins can help prevent damage that air pollution causes. So what they looked at was a pilot using folate, B12, and B6, and they actually exposed people. They have chambers now called particulate chambers where they actually expose people to pollution, PM 2.5. And then they looked at how, after this exposure, how the intervention with B vitamins would actually affect oxidative stress. And what they found was that what we would consider a conservative intervention, right? 2.5 milligrams of folic acid, 50 milligrams of B6, and a milligram of B12. That's not so conservative, 1,000 micrograms, but a milligram of B12 given for 4 weeks basically prevented the damage that PM 2.5 had on heart rate variability. In other words, it normalized heart rate variability by 90%. So almost completely reversing the effect that air pollution exposure had on heart rate variability. It also normalized heart rate, and it normalized white cell count and lymphocyte count. And all these effects, remember there was a baseline. Not only was there a baseline, but they actually had a placebo chamber where people thought they were being exposed to air pollution, and they were really being exposed to quote unquote medical air, otherwise known as air, purified air. So very important, extremely cost-effective intervention. That there was a follow-up study where they actually looked at whether this exact same intervention had been able to do anything at the level of the mitochondria. And this was kind of the eye-popping part of this study, is we know this, that air pollution actually causes DNA damage in the mitochondria via methylation-induced DNA damage. And that simple intervention prevented the damage to the DNA, the mitochondrial DNA. So it was very effective, not only on a macro level, but on a micro level as well. So that's one, I think, that's a pilot project that will continue, that these researchers will continue. Oh, one thing I want to say is that this was not methyl B12 and it wasn't methylfolate. It was regular old folic acid and regular old vitamin B12 and regular old vitamin B6. So pretty impressive, even for non-methylated B vitamins. So the respiratory tract itself, which is the first line of defense, it's called the respiratory tract lining fluid. So it'd be in a way synonymous with the mucus lining of the intestinal tract, where all the action happens, is full of antioxidants. Not only antioxidants that we know and love, like glutathione, vitamin E, vitamin C, and alpha tocopherol, but antioxidant enzymes like glutathione peroxidase, superoxide dismutase, and catalase. And these are very easily depleted by exposure to PM 2.5. What we've seen, and there's a whole host of studies using very, very conservative interventions with vitamin C and vitamin E, and just as regular old D-alpha tocopherol. Tocotrienols also are very important in the respiratory tract lining fluid as well, but unfortunately, nobody studied them. Very small interventions like 500 milligrams of vitamin C, up to 2 grams a day, 500 milligrams 4 times a day, have been shown to decrease airway irritation as a result of gas exposure, ozone exposure, and then a really good study that was published in Environmental Health Perspectives, looking at, I think that reference actually is in the next slide, looking at 500 milligrams of vitamin C and 800 international units a day, leading to increased blood levels of glutathione. Not only glutathione, but the enzymes superoxide dismutase and catalase, which are crucial antioxidants, in adults who are breathing smoke from a coal-fired power plant. And some of these were actually the employees that worked at the coal-fired power plant. So that's a really important intervention as well. Very often, because I lecture on vitamin E quite a bit, very often I get asked, does vitamin E really work as an antioxidant? And here's proof that it really does work as an antioxidant. And this is only just singular alpha tocopherol. Of course, we'd prefer to use the complex of tocopherol, the tocopherol family, gamma delta alpha, and the tocotrienols as well, because that's a much stronger antioxidant intervention. Another really, I think, important intervention here is to look at some of the research that's been done on fish oil. These were 2 studies. The Environmental Health Perspectives study was the olive oil and fish oil. And that was interesting because they looked at again, they put people in a particulate chamber and they exposed them to air pollution. And they looked at the effect of olive oil versus fish oil. And what was really interesting, olive oil, very strong antioxidant, massive evidence that it is probably the most important part of the Mediterranean diet. But olive oil did not have the same effect that fish oil did. Fish oil had a significant protective effect, highly statistically significantly protective for heart rate variability. And again, heart rate variability is secondary to the inflammatory and oxidative stress effects of air pollution. So this was 3 grams a day. It was 400 milligrams of EPA and 275 milligrams of DHA every day, easily achievable. And these were exposed folks. These were adults that were exposed to a significant amount of air pollution. The nursing home residents were getting 1.5 grams, basically, of EPA every day. And they were also exposed, I don't know how ethical that is, but they were also exposed to PM 2.5 on a regular basis. And, this is, the exposure would be the equivalent of living in a large urban area where there are hazardous levels of air pollution. And that also had a very protective effect on heart rate variability. So I think this is something that we can very assuredly use as an intervention. And I would say, for everybody who lives in an urban area, this is a daily intervention. This is cardioprotective. As we know, there are individuals who are more sensitive to the effects of air pollution, wildfire smoke, building smoke than others. And although I was interested to read in the literature that it seemed to be kind of a question, we don't know how to identify these individuals, there's pretty good evidence that says, yes, we do know how to identify them. They have SNPs in the following enzymes. So we're talking about GSTM1, GSTP1, NQO1. So that's a nitric oxide SNP, TLR4, which is not tested for very often, but it is part of 23andMe, NRF2, which we know is a big part of the antioxidant response, and superoxide dismutase 2. They play a very strong role in how our respiratory tract responds to air pollution. Especially the most overwhelming research is for GSTM1 null gene deletion. And those are the folks who are probably at greatest risk. The reason I'm saying this is because I'm now going to be talking about sulforaphane. And there's evidence that sulforaphane is specifically more protective for GSTM1, GSTT1, and GSTP1 null deletions. And, there's a plethora of research on sulforaphane, mostly for chemoprotection. That's where the biggest area of research is actually in chemoprotection from very specific cancers. But what's not well known about is that it's also very effective in improving the body's ability to detoxify, specifically upregulating phase 2, and specifically upregulating glutathione transferase, glutathione reductase, and gamma-glutamyl cysteine synthetase, which is a glutathione production enzyme. So the enzymes that are crucial in helping us keep healthy levels of glutathione. The human trial that was done recently in Qidong, China, with help from the researchers at Johns Hopkins who've done most of the sulforaphane research. And this is the third bullet point down here. They were using 600 micromoles of glucoraphanin. That's what's found in broccoli and broccoli sprouts. And 40 micromoles of sulforaphane. That's what it gets turned into either with our own gut flora or an enzyme called myrosinase that's available in foods like daikon radish. They found that with that intervention, they found a really significant increase in the ability of these individuals to use glutathione to excrete pollutants, and they measured 4 of them. I just mentioned 2 here. There is more research than I can even point to tonight that I have time to talk about. But what they found basically, and this is, there were about 10 papers that came out of that study in Qidong. But what they found was that they basically had about 20 to 50% increase just with this input or this intervention in these individuals. There were about 270 individuals in this study with the broccoli sprout. It was a dried broccoli sprout beverage. It was a powder. They put it in water, stirred it up, and drank it. But what I want to say about this is that Johns Hopkins has done research. They've actually created a hybrid broccoli seed that has higher levels of glucoraphanin, higher levels of sulforaphane. There's a lot of glucoraphanin and a little bit of sulforaphane in a broccoli seed. But here's the bottom line. What they found in the study was it really didn't matter whether they gave the individuals in the study a lot of glucoraphanin or a lot of sulforaphane. They found the increased rates of detoxification, or what they call, the actual formal word is detoxification, with either one. So if you hear speakers, sometimes they'll say, well, glucoraphanin, it's the precursor to sulforaphane, and it doesn't work. You have to actually have the activated sulforaphane. It turns out, and this is the best evidence from this human study, that the researchers were kind of surprised. It doesn't matter. You can give your patients broccoli sprouts, and whether they take it with daikon radish or not, they're still going to get the same upregulation of phase 2. So, standard dose of sulforaphane, and that's how we usually give it, is in the pill, activated sulforaphane. It's not activated, that's the wrong use of the word. It's actually sulforaphane derived from glucosinolate. The average dose is 30 to 50 milligrams a day if you're using it for upregulating phase 2. So that's my slides. It looks like we are getting some Q&A happening here, and we will have time for questions at the end. But I'm going to go ahead and turn the stage over to Dr. Krinian so he can share his slides. Walter, you're on mute, just so you know.
Thank you for reminding me. So what I'm going to focus on is what I would like to call the duct tape of environmental medicine supplements, NAC. It's like 101 uses. It's good for like just about everything. It's got its own antioxidant ability, not just from increasing glutathione levels for those that have the enzymes necessary to make glutathione, which is at least 80% of the people. It's got its own antioxidant activity. It's got its own anti-inflammatory activity. It drops TNF-alpha. It lowers high-sensitivity CRP. It is a mucolytic, so it's been used for a long time, Mucomist. It's wonderful for mucus problems in the lungs. It knocks out biofilm, but beware, don't give it to people with peptic ulcers unless you want to get a lot of very nasty phone calls. And it's glutaminergic. It helps balance glutamate levels, which, as you know, is an excitatory neurotransmitter. So I went on PubMed and went to their clinical queries, which is an excellent service that PubMed has. and did NAC and then looked at just their reviews. And there were a couple hundred on them. And I just looked at some from the last maybe 5 years. Here's some of the things it shows up. Protects diabetics from heart attacks, prevents ischemic heart damage. Cardiovascular, it's astounding. It reduces obsessive compulsive disorder and lowers depression and anxiety, improves cognition, reduces addiction craving, including cocaine, reduces irritability in autistic children, prevents damage to the kidneys from contrast dye, helps in PCOS. When given to women with PCOS, they're able to conceive better. And as I mentioned, it knocks out biofilms. This stuff just does everything. So here's the article, Michael Hoffer, that I showed last time, the 2013 article on military personnel in the Anwar province. And I got a few quotes from them. I just wanted you to get a better sense of what was going on here. So exposed individuals. Exposure was defined as feeling a blast wave or being in a vehicle that was damaged by a blast wave, and then with resulting alteration of consciousness, which required a report by another individual on the scene, obviously because if the person lost consciousness, they couldn't tell you, and resulting balance dysfunction, confusion, headache, sensory neural, hearing loss, impaired memory, and sleep disturbance. Those were all considered as mild traumatic brain injury symptoms. So that's what they are looking at. They measured balance dysfunction. They measured a thing called abnormal head thrust by looking at the eye motion after turning the subject quickly. They did Romberg on them for balance. They did gait testing on them, and the resulting criteria at the end, if there was resolution, they no longer had balance dysfunction, were no longer had dizziness, had normal head thrust, the Rombergs were fine, then they had normal dynamic gait index, then that was the criteria for if they got better with the 7 days of treatment. They also measured hearing loss, looked at on self-reports, confusion, headache, sleep disturbances, and impaired memory. And the resolution required that the patient stated, I feel as good as I did before the blast. And then they did neuropsychological tests on them. And I've talked a lot about using neuropsychological testing. It's low cost, it's easy to do. You do it on a computer, online, or in your office, 20 minutes, and you get readings to show if this is different than what their age would normally show. Neuropsychological testing is the most sensitive testing for cognitive damage from things that aren't due to normal aging. So 81 service members, a 4-gram loading dose, which is more than I've ever given anybody. And then for the next 4 days, they did 2 grams twice a day. And the last couple of days, they did 1.5 grams twice a day. So it was only 7 days. Now, if you take too much NAC, you can end up with some GI problems, especially if you got the peptic ulcer thing going on. None of these servicemen or women had any adverse side effect from it. And the odds ratio for having no symptoms of mild traumatic brain injury in the NAC for those not overtaking the placebo, 3.6. 3.6-fold more likely to, at the end of 7 days, have none of those things I just talked about. So they got improvement in their cognition, in their depression, in their balance, in their mood, in their cognitive ability as measured on neuropsychiatric testing. Astounding results. All these problems from TBI, as I mentioned in the last seminar, are results of neuroinflammation. And all particulate matter and air pollutants cause neuroinflammation. Now, what was really cool thing that I read in this article that I had not known before is that NAC does not cross the blood-brain barrier well. But when there is neuroinflammation, that blood-brain barrier is damaged. That's why it's helpful in these people, in individuals with autism, in individuals with depression, in individuals with OCD, because their blood-brain barriers are not working right. So the NAC can get in. So p-value, highly positive, that NAC treatment significantly better than placebo, and the earlier they got to them, it was even better. And that the NAC group had normalized neuropsychological tests within 7 days. Normal cognition within 7 days after traumatic brain injury. Neuroinflammation, as we covered in the 2016 EHS, cognitive difficulties, a major one, mood problems, another major one. NAC, it is the environmental medicine supplement duct tape. It works for just about everything. So let's look at the things here that has been shown to work with. Cigarette smoke, which is particulate matter and aromatic hydrocarbons from combustion. Same thing you have in anything that's burning. Reduces lung inflammation, corrects reduction in glutathione levels. It's chemoprotective, means it prevents lung cancer from happening in cigarette smokers. PM 2.5 ameliorates oxidative stress. Diesel exhaust particles boosts glutathione, blocks oxidative damage, reduces airway reactivity from diesel exhaust particles, i.e. reduces asthma. Blocks pro-inflammatory cytokine production and reduces cyto and genotoxicity. First, the solvent TCE prevents oxidative damage. Rotenone induces Parkinsonism, it prevents. Acute organophosphate poisoning significantly reduces malondialdehyde, oxidative stress, and increased glutathione and reduced atropine dose. So far, particulate matter, aromatic hydrocarbons, and those are both in diesel exhaust, cigarette smoke, but also in all fires, whether they're house fires, car fires, wildfires. Now, will pesticides be there? Yes, because things that have been treated with pesticides are burning. So aluminum phosphide is another insecticide, fungicide. Again, it treats that. The chlorinated pesticide, endosulfan, an organophosphate, malathion, it prevents oxidative damage. NEK, another solvent. Acetaminophen, well, it's the standard treatment for preventing liver damage from acetaminophen. Phthalates prevents DNA damage from phthalates. It reverses glutathione loss from phthalates. You're going to hear a lot about phthalates at the Environmental Health Symposium 2019. And prevents mitochondrial dysfunction from phthalates and prevents phthalate-induced cell death. Now, a lot of these cells that are death from the phthalates includes things like the Sertoli cells in the testicles. So we've had particulate matter, aromatic hydrocarbons, pesticides. We've had a few more pesticides here. So we've had a whole variety of pesticides that it works with. We had TCE, and now we got MEK, so it does the solvents, acetaminophen, and plasticizers. Our plasticizers in the smoke that has been happening because of the fires. Yes, from all the buildings and cars that are burning. Well, another endocrine disruptor. Bisphenols prevent cellular apoptosis, the death of cells, attenuates oxidative stress, and attenuates the reduction of glutathione in brain cells. It reverses cognitive dysfunction caused by bisphenols, perfluorocompounds, mycotoxins. So if you've been paying attention to this list and you remember the list from Dr. Tolzman, that Dr. Patrick showed right at the beginning, everything that's in this fire smoke is ameliorated by the duct tape of environmental medicine supplements, NAC. And the typical dose in just about all these studies is 1,800 milligrams a day, 900 milligrams twice a day. All the metals it works with, every single one of the metals it works with. Arsenic, cadmium, it protects against cellular damage in cadmium, which is a huge issue with cadmium because it causes renal damage and reduces the pro-inflammatory effect of cadmium. Chromium-3, which I live in Arizona, my water's high in arsenic and chromium-3, along with a lot of other very nasty things. For chromium-3, cadmium and cobalt, as in metal on metal hips, suppress cytotoxicity and apoptosis and enhance p53 activation, so preventing cancer by repairing DNA, prevent cellular uptake of the metals. Mercury, it does enhance mercury excretion. Now, here's another one of those things. When I first read that study on methylmercury excretion in animals from NAC, I thought, well, it's got to be because it increases glutathione. Wrong. NAC has its own action on the phase 3 membrane-bound efflux pumps. That's how it does it. It's got its own action. So in this study, if you read that study, it wasn't through glutathione. It was from its own action of NAC. So if you're taking glutathione and think, I don't need NAC, please, please think again. And 1,800 milligrams of glutathione a day are literally thousands. Video is that every single one of those tools that have battery in it, battery as 1478 significant in levels in lead workers. So we're looking at a very high lead level that this is effective against. NAC, it is for an environmental medicine supplement, it is the duct tape of supplements. So Lynn, there's my presentation on NAC. And you know, you did the B vitamins, you did vitamin E, and here I'm doing NAC. And those are 3 that I think are overlooked so very much. It's not flashy new like, hey, sulforaphanes, glucoraphanins, oh, curcumin. It's none of these sexy things. And we tend to forget these basic nutrients that are so incredibly powerful. And these are all very low cost.
Yeah, very low cost. Can be used preventively, proactively, daily in adults and children. Okay, reminder about 2 things. One is the slides are available in PDF form and the Dropbox link that is in both the questions and the answers of your Q&A box. So you can find them either place. We will also be sending out the recording. We're recording this, and we'll be sending it out to you, I think very soon, probably in the next couple of days. So stay tuned in your inbox for a copy of the recording so that you can catch the dialogue as well as the slides. So let's see if we have any. Walter, there, can you see the Q&A panel?
That's what I just got out of. I'm trying to get there.
Well, let me tell you, because the questions are all about NAC. I'd love you to comment.
Okay. So do I need to stop my video to do that?
You might need to stop sharing. But you don't have to. I'll just tell you the questions.
Okay, I only see one so far.
Yeah. So NAC, can you comment on the use of NAC increased risk of bleeding as well as asthma as a contraindication?
Any articles on that. When I did that review of NAC, I did not see that, so I cannot comment.
Yeah, I did answer the question. I typed it as you were talking, and the only contraindication I would imagine is bleeding peptic ulcer. Absolutely contraindicated to use NAC in that situation. Would NAC be better used orally or nebulized for its protective effects on lung tissue? And I already answered it, but I want you to comment as well. Oral daily is preferable unless it's a COPD case or chronic bronchitis. You know, we I've been using long before NAC was compounded by pharmacies. There's prescription NAC, which is Mucomist. We used to use it back in the emergency room for a really chronic bronchitis where you need to loosen mucus in the bronchioles. So that's an absolute indication for inhaled NAC, nebulized NAC. Do you want to comment?
The vast majority of all these articles on the benefit of NAC was with oral. Now, there was some IV use of NAC for preventing kidney damage from contrast dye, but almost everything else was oral use.
Okay. And then Renee, to download the slides, there is an actual link in the Q&A panel that I posted at 8:31. You can just scroll up and you'll see an actual URL for Dropbox. And you don't need a Dropbox account. You can just have access to it. And that's where the slides reside. And if for some reason you're having difficulty, we're going to send them out with the recording as well. So you'll get them either way, whatever's easiest. All right, I think.
And Bridget, I've not seen anything about the studies. None were consistent about with food or without food. There wasn't a consistency there. It seemed to work either way. I take mine with meals.
Great. Oh, there's a question about N95 too. The problem with N95 masks, gosh, I'm trying to remember where I saw that webinar. I think actually California Health Department put out this webinar during the heavy smoke periods, the California EPA, sorry. And what they said basically is that exposure with an N95 face mask is greater than staying inside. The problem is that it leaks right here, that it doesn't have a tight fit, even with that little those two little elastic straps. So it's not as good as an actual respirator, you know, the kind that you should be wearing if you're using solvents, the really uncomfortable, heavy rubber respirators. But it's about the fit. And with a PM 2.5, you know, it's basically paper. You can't get a tight seal around your mouth. So it's better than nothing, but it's not protective.
Yeah.
It's not as protective as staying inside with your air filter running. That's for sure.
There is a question here explaining why not to use NAC with COPD.
Well, that's a misunderstanding.
Yeah,
that's a misunderstanding. My answer was, when you have someone with COPD, that's when you need to use nebulized NAC because of the severity of the disease. So it was really about the severity. If you've got a more severe chronic respiratory damage, then nebulized is really appropriate.
Yeah, there's a number of studies on oral NAC with COPD, and they seem to, orally, it prevents further loss of lung function, but didn't roll it back. So this is why you'd want to use the nebulized.
Yeah,
NAC.
absolutely. Oh, here's a question for you, Dr. Krinian. Is there further recommendations than a Hepa filter in air purifiers in times of smoke exposure?
Yeah, thank you.
Talked about
I
this.
covered that quite in depth
Yeah.
on the first one, in that these fires are going to keep happening. They're going to keep happening, and we're going to have more of them. If you're in any area where there's smoke like this, you need to have good air filtration in your home, because prevention is worth tons of cure here in this situation. And I showed the article in the first Wildfire 1 webinar, on using the MERV 16, which is a 5-inch thick HEPA filter in your furnace, in your HVAC system, that knocked out 60 to 80% of ultra fine particle, which are less than 0.1 micron, while PM 2.5 is less than 2.5 micron. So it's astounding. If you can't fit that in your home, and I highly recommend, if you're in any area where there's wildfires happening, and if you're in any major urban area, you seriously consider this. If you can't do that, then you get the IQ or the Boston or the Blue Air, or one of those really high quality ones in your bedroom. If you got a big house, you're going to need more than one. But that prevents the exposure to all this stuff we're talking about. The less you're exposed, the less you need to treat.
Yeah, and speaking of webinar 1, Dr. Krinian went into great length about air filtration. So if you have not been able to access our first webinar, the first part, which we did December the 10th, please go to ehs2019.com, ehs2019.com. You'll be able to access it there. As well, we really warmly invite you to come. If this is interesting, relevant material for you as a healthcare provider, and you want to be able to access more information about environmental exposures and appropriate treatments, please come to EHS 2019. There is really a community of healthcare providers there that are committed to integrating environmental medicine into their practices. And I'm talking about everything from naturopathic physicians and family care practitioners to nephrologists and internal medicine, and we even have some anesthesiologists that come to EHS. So I think that's all we have for now. Dr. Krinian, do you have any closing words before we sign off?
Everybody has a good 2019.
Yeah, coming up. All right, take care. We'll see you in Scottsdale in April.
Great. Thank you.